Welcome to The Explainer. Today, we're tackling a hidden cardiovascular danger that, honestly, millions of people are completely unaware of. And the crazy part, it might be sitting right inside your own home.
Think about this for a second. What if the pill sitting on your nightstand right now is quietly damaging your heart? Not the disease you're treating, not your age, the actual medicine itself. Now, I'm not here to scare you, but cardiologists are issuing some really serious warnings about incredibly common prescription drugs. We're talking about meds your doctor might have given you years ago, and you've just kind of kept taking them out of habit. Now, what's really interesting about this slide is the sheer scale of the situation. Look at that 40% slice. Right now, more than 40% of Americans over 65 are taking 5 or more prescription medications every single day. That is a massive chunk of the population. And unfortunately, some of these very common everyday drugs have been linked to a significantly higher risk of heart attack and heart failure. Okay, before we go any further, I need to pause and make something absolutely crystal clear. This explainer is for educational purposes only. Please do not stop taking any medication without talking to your doctor first. Quitting certain medicines cold turkey can be incredibly dangerous. Our goal here today is just to empower you, to give you the information you need so you can have a really smart, confident, and medically sound conversation with your doctor at your next visit. So here's our roadmap for the next few minutes. We're going to look at everyday remedies, chronic management drugs, paradoxical prescriptions, and then we'll wrap up the whole shebang with a concrete action plan. Okay, let's dive into this. Section 1, Everyday Remedies. We're kicking things off with the surprising risks hidden in common pain and infection meds. This first category is probably the most shocking because, well, you can just grab these off the shelf without a prescription. They're called NSAIDs, non-steroidal anti-inflammatory drugs. I guarantee you know the household names: ibuprofen, Advil, Motrin, Aleve, naproxen. Millions of seniors pop these daily for arthritis, a stiff back, or just a nagging headache. They seem totally harmless, right? Like eating candy? Well, let's look at what the research actually says. The FDA has actually issued a warning about these. They state that NSAIDs can increase the risk of heart attack and stroke. And get this, that risk starts as soon as the very first week of taking them. There was this huge study published in the British Medical Journal that found people taking NSAIDs regularly were up to 50% more likely to be hospitalized for heart failure. 50%. That is a staggering number for a pill you can literally buy at the grocery store checkout. To put a human face to these numbers, let's look at Dorothy's story. She is a 72-year-old from Georgia who took Aleve every single day for knee pain for about 2 years. She felt completely fine until, out of nowhere, she suffered a mild heart attack. When her cardiologist looked into it, they traced a big part of that risk directly back to her long-term NSAID habit. The good news? Once she switched to safer alternatives, like Tylenol, which is acetaminophen, and a topical cream, her heart health actually bounced right back. All right, let's move on to our second everyday remedy, and this one surprises almost everyone: antibiotics, specifically a class called fluoroquinolones. You might recognize the brand names Cipro, Levaquin, or Avelox. These are incredibly common prescriptions, often handed out to seniors to clear up stuff like UTIs, sinus infections, or pneumonia. Well, the FDA has flagged these fluoroquinolones because they can cause something called an aortic aneurysm. Basically, that's a dangerous widening of the main artery in your body, and if it ruptures, it's incredibly serious, often fatal. To put in perspective, one study showed that seniors taking these specific antibiotics had a 66% higher risk of an aortic aneurysm compared to folks taking other types of antibiotics. So the takeaway here: if your doctor prescribes an antibiotic, just ask, hey, is there a safer alternative that works just as well? Moving right along, that brings us to Section 2, Chronic Management. Here, we're looking at the hidden dangers in older drug classes used for long-term health issues. This next medication category is absolutely critical, mostly because roughly 1 in 3 Americans over 65 has diabetes. Now, don't get me wrong, most diabetes medications are super safe and some even protect your heart. But there's this older class called sulfonylureas, which includes drugs like glipizide, glyburide, and glimepiride, that's been linked to increased heart risk for some patients. You see, they work by forcing your pancreas to pump out more insulin, but the catch is they can sometimes cause your blood sugar to crash way, way too low. That severe drop is called hypoglycemia, and believe it or not, it can actually trigger a heart attack in older adults. Take Frank's situation. Frank had been on glyburide for years. He started getting these dizzy spells and then actually collapsed one morning. His blood sugar had just completely tanked, which put an immense amount of stress on his heart. Luckily, his doctor caught it, switched him to a newer, heart-safer diabetes med, and those scary episodes stopped completely. Medication number 4 belongs to what's arguably one of the most overprescribed drug categories for seniors in America, benzodiazepines. You absolutely know the brand names here: Xanax, Valium, Ativan, Klonopin. They're usually prescribed for anxiety and sleep problems, which, let's face it, are super common as we get older. But here's the huge red flag. These drugs slow down your entire central nervous system. In older adults, that means they can severely lower your blood pressure, lead to really dangerous falls, and put a ton of stress on an aging heart. When you compare the options, it really puts things into perspective. Research from the Canadian Medical Association journals showed seniors taking benzos had a 51% higher risk of Alzheimer's disease. 51%! Plus, long-term use is linked to more cardiovascular events, and they're highly addictive. Compare that with CBTI therapy, that's cognitive behavioral therapy for insomnia. It actually works better in the long run and carries zero heart risk. But again, remember our golden rule. Do not stop taking your sleeping pills suddenly. You have to work with your doctor to taper off safely. All right, let's move to section 3, paradoxical prescriptions. This is where things get a bit tricky, where medicines meant to heal one thing inadvertently strain the heart. Our 5th medication requires a little bit of nuance, honestly, because most blood pressure meds are fantastic for your heart. But there's this older category called alpha blockers, drugs like doxazosin and tauroxazine. A massive government study, the ALLHAT trial, actually found that patients on certain alpha blockers had a higher rate of heart failure than folks on other blood pressure meds. And here's the real kicker. Alpha blockers are also widely prescribed to men for prostate problems. So you've got guys taking these pills for their prostate, having absolutely no idea it's messing with their blood pressure and stressing their heart in the background. Our 6th and final medication category is a really sensitive one, and I want to be super clear here. Because mental health medication is absolutely vital for millions of seniors. I am definitely not telling you to flush your antidepressants. But there is an older class of antidepressants known as tricyclics, think amitriptyline, nortriptyline, and doxepin, that have been linked to heart rhythm problems. For older adults, these meds can cause the heart to beat irregularly, which is called an arrhythmia. And if your heart is already aging or under stress, that can become seriously dangerous. And this brilliantly illustrates why reviewing your meds is so important, because there are much safer alternatives out there. A study in the American Journal of Cardiology found that long-term use of those older tricyclics in older adults was linked to a 35% increased risk of cardiovascular events. But newer options, like SSRIs, are generally considered so much safer for your heart. Truly, a simple 10-minute conversation with your doctor or psychiatrist about upgrading to a newer option can protect your heart without sacrificing your mental health. Okay, we've covered the hidden risks. Now it's time for section 4, your medication action plan. Let's flip the script, shift gears from feeling worried, and turn you into a totally empowered health advocate. Let's bring this all together. Imagine I'm a trusted cardiologist sitting right across the table from you. Here is your 4-step game plan. Step 1, make a list. Write down literally every single medication you take, prescriptions, over-the-counter stuff, vitamins, and the doses. Step 2, book a medication review. Literally call your primary care doctor and ask for this specific type of appointment. They'll review everything for bad interactions, and hey, a lot of Medicare plans cover this for free. Step 3 is asking 3 specific questions, which we'll cover in a second. And step 4, I'm going to say it one more time, never ever stop a medication on your own. So the crucial point is knowing exactly what to ask when you get to that appointment. Feel free to pull out your phone and screenshot this slide right now. Question 1, is there a heart-safer alternative to any of my current medications? Question 2, are any of my meds interacting poorly with each other? And question 3, given my age and my heart health, is every single one of these still absolutely necessary? Asking these questions doesn't make you a difficult patient, it makes you a smart advocate for your own life.
Which leaves us with this final question. Is your heart worth having that conversation? If you're over 60 and you're juggling multiple medications, please do not ignore this. There's no need to panic. You just need to be informed. Print out that list, ask those 3 questions, and advocate for yourself. Now, if this explainer opened your eyes, there's another hidden danger that's honestly just as serious. Most seniors have no clue what's happening inside their bodies right now. It involves the 5 silent warning signs of a heart attack that can appear weeks beforehand, and almost nobody recognizes them. Check out our next explainer on that exact topic. Take care of yourself and keep learning.